So COPD that's an acronym for chronic obstructive pulmonary disease. Most often due to smoking, but can be due to chronic asthma or other occupational exposures. And really what it is a chronic, as in irreversible, disease of the lungs where a individual mainly gets breathless on exertion. And that breathlessness can vary in severity, depends on how severe the disease is, and has daily impact.
What the program is providing at the moment is a joint effort between primary and tertiary care. So we're bringing specialists out to GPs to help upskill general practice staff and then channel more people into pulmonary rehab programs, because we know that the evidence is there that that's the best outcome for these patients.
I think hopefully a lot of the work we're going to be doing in the COPD workstream for the Alliance is to break down that divide between the hospital and acute sector and what happens in the community in the primary care.
Just around 1,000 patients were admitted in 2017 for exacerbation of their chronic obstructive pulmonary disease, and that was to Belmont, the Calvary Mater and also the John Hunter Hospital. And we know that a lot of those patients suffer a lot with their respiratory disease. We know that only a couple things really work for COPD, and one of those is pulmonary rehab.
There's a great body of evidence that says that pulmonary rehab programs provide much better outcomes, and yet when we looked at the local statistics, only 5% of patients who should have completed a rehab program after that hospital admission actually did so. One of the aims is to increase that rate from 5% up to 15%, to not only improve the patient's symptoms and their control over their symptoms, but also hopefully to prevent readmissions to hospital.
The biggest barrier is just patients not knowing that this is very helpful for them, and the patients that do it enjoy it and do very well out of it, and we know it reduces exacerbations and helps manage symptoms.
6 weeks I'm so happy. I feel so much better. Even, I'm not doing enough at home yet. When I knock off here, I'll make sure I'll keep it up. It's been a marvellous program.
Rehab gives you education. We do an hour of education on Tuesdays, which informs us about the complaint we have, COPD, which covers a number of different complaints.
Exercise, that's all it is, exercise, and that's all you need.
You learn about the complaint you have, and you do exercises which are compatible with what you actually your body can do now.
I've got my wife on it now at home. She's doing it. Yeah, so I've enjoyed it.
I would definitely recommend it to other people. It's a must if you have COPD.
Chronic lung disease really, from the patient's point of view, is sort of in their face every day. And if we can do things or intervene to help lessen those symptoms, then hopefully we're doing a very good thing.
We're really looking forward to seeing GPs supported and patients supported and increasing referrals across to pulmonary rehab. If we get them here, we can help them continue to stay here in our pulmonary rehab programs.
So what we're doing is hopefully improving outcomes for patients, but also streamlining and improving the healthcare system by working together and getting better outcomes for patients and the system as well.